At Next Health, as part of our executive physical, we do the advanced cardiac evaluation. Not only are we able to look at what's in the blood, we can actually get a three-dimensional image. So instead of relying on a cardiac catheterization, which is an invasive procedure and two-dimensional, we actually have the technology to do what's called a three-dimensional cardiac evaluation. So not only can we see the plaque that's built up with what we call stable calcium, we can see the non-calcium plaque, and most importantly, we can actually check for soft, low-density plaque. Those are the ones that can rupture and cause a heart attack. So not only can we get a three-dimensional picture, we actually do biochemical tests, which we describe as advanced cardiac tests. That involves what's in the blood. We want to look at the things that create inflammation, that creates oxidation. These are the things, amongst others, which are very important risk factors for actual heart attack. And then we look at the lipoprotein particle size. In other words, the density of the LDL is far more important than how high the LDL is. The molecular size of the LDL and other dense particles like lipoprotein (a) are the most atherogenic. In other words, they're the ones that create majority blockages. So when your doctor is looking at the lipid profile, he's not looking at the molecular size. He's not looking at the true risk of a heart attack, which is inflammation and oxidation. And that's why it's important to not only look at what's in the blood, the biochemistry, we need to actually look at the anatomy. And that way you get a complete picture of the in and out of the body. In fact, most people that have heart attacks have normal cholesterol. So when you have somebody with existing heart disease and you lower the blood pressure and you lower the blood sugar and you lower the cholesterol, they only get a 25% reduction in future heart attacks. Why? Because they're not evaluating the molecules that create blockages like lipoprotein (a), like dense LDL. They're not evaluating the true risk for a heart attack, which is inflammation, oxidation. These are the things that need to be evaluated, and most importantly, do we have the ability to reverse it? And the answer is yes. So in most cases, this is all preventable. Not only can we do advanced genetic testing to see who's more vulnerable to the heart disease, not only can we look at your biological age, because if you're prematurely aging, you're more likely to get the age-related diseases, and cardiovascular diseases, age-related disease. And so not only do we do that, we want to look at what's on the inside. And by making the dietary changes, by replacing nutrients that raise your antioxidant function so that your immune system can reduce inflammation by itself, by looking at which foods create inflammation and altering your diet based on your blood test, based on your intracellular vitamin levels, we can also replace nutrients that can target inflammation, nutrients that target fatty liver, nutrients that target insulin resistance, nutrients that target, slow metabolism. All these are part of what we call the cardiometabolic spectrum. And frankly, if it's good for your heart, it's good for your brain. If it's good for your heart, it's good for your immune system. So it's one of the most dynamic evaluations, and it's a three-dimensional evaluation of what's on the inside of the body and the outside of the body. And at Next Health, it's all part of the elaborate executive physical that looks at everything from top to bottom, and your heart is the most important organ to think about.